Hello and welcome to today's webinar. My name is Trevor. I'm the Communications Manager for the Canadian Cancer Survivor Network. Thank you everyone for attending today's webinar. It's in the fall leg of our 2024 webinar series. If you're new to our webinar series, a little background on our group. CCSN works to connect patients, survivors, and other stakeholder groups with decision makers in the wider community to engage in discussion and to act on evidence-based best practices to alleviate the medical, emotional, financial, and social costs of cancer. To learn more, visit survivornet.ca. This webinar is being recorded and will be available on YouTube, and a link will be provided by the email you registered with, along with a link to the slides. We will add a quick Q&A session at the end, but if you'd like, put your questions in the questions function on the GoToWebinar menu. And now I'm pleased to introduce our partners from the Lung Health Foundation, a group dedicated to ending gaps in the prevention, diagnosis, and care of lung disease in Canada. I will now hand it over to their Vice President of Programs, Research, and Public Affairs, Jess Rogers, to kick off the talk, Youth Vaping and Lung Cancer Risks, what we know, what we don't know, and how concerned should we be.
There we go. Thanks so much, Trevor. And before we kick things off, I do just want to acknowledge CCSN because you guys are such a strong partner of ours. And we've enjoyed working with you, and of course, welcome this opportunity to speak to people from coast to coast to coast. So as Trevor said, the Lung Health Foundation is excited about this topic. It's one that we get a lot of questions about, as you can imagine. Yeah, you can stop there, Natalie. Thank you. And so I just want to give a little bit of an anchoring as to who the Lung Health Foundation is. If you are in Ontario, you may know us by our previous name, which was the Ontario Lung Association. We have a long-standing history working to advance lung health in the province of Ontario. Several years ago, we actually expanded our scope to become national. So while still doing work in Ontario, we also advocate and support people with lung health concerns across Canada. And so one of the important pieces of what we do is advocacy. And one of the ways we work with CCSN and Lung Cancer Canada is actually to work on patient drug submissions to the Canadian Drug Agency to be able to be the voice of people living with different lung diseases, in this case, lung cancer. We also run education programs for healthcare professionals, but also people living with lung disease, as well as their caregivers. We run a research program as well. And so just to give you a little taste of that, I'm going to provide a link at the end of this webinar if in fact you would like to get involved with us or at minimum access some of our services and tools. Next slide. So where are we focused? Lung health is a huge area and we want to help every Canadian breathe better. So we are involved across the board, regardless of a lung health topic. But we do try to focus in this current strategic plan that we're in, we're focused in 5 main areas. So the first you'll see is asthma. COPD is chronic obstructive pulmonary disease. So think bronchitis, think emphysema. It's a real focus of ours nationally to raise awareness around COPD because so many people across Canada have COPD and their lives could be better. Lung cancer. So this is what we're here to talk a little bit about today, around giving people a fighting chance who have lung cancer. And so that requires us to screen people, diagnose early, and make sure that we've got that diagnosis tied directly to the treatment options that are available so everyone has equitable access to the best care possible to increase their chance of survivorship. We also focus on infectious respiratory disease. So there we're talking about immunizations for the most part. So flu vaccine, we're in the season, flu vaccine, pneumococcal pneumonia, as well as COVID-19. And then we also do work in smoking and vaping cessation, as well as prevention. And so you'll see 2 of the topics that we're laser focused on is what we're going to tackle today. Our focus right now in vaping has been on youth, so people from sort of 16 to the age of 30. And we're just really excited to hopefully bring some new information to you. I learn every time we talk about this topic because the research is emerging. We're learning every day. So hopefully you will walk away from today's session with a little bit more knowledge around what vaping is, what impact it has on your lung health, and maybe be able to support yourself or others in thinking about making a quit attempt, whether it be smoking or vaping. So we're really excited. And just to echo Trevor's instructions there, if you do have questions or comments, because this can also be about a conversation between people that are on the call, please feel free to put it in that chat Q&A section. Trevor's going to be monitoring it as we go. Next slide. So can you go one more slide, Natalie? We were, one of the things Lung Health Foundation is so proud of is working with our patient advocates, our lung health ambassadors. And Heather Hogan was to join us today to give you guys just, a sense of what it's like being someone who has had lung cancer and how Heather gives back. Heather, however, despite her best efforts, was not able to overcome her flu, but she is watching from New Brunswick. So hello to Heather. I did want to read her bio just because I think she's an example of how we cannot do the work we do without patient advocates, and how much patient advocates volunteer their time across many organizations to give back. It never ceases to amaze me since working in this space. So Heather is a retired teacher and school administrator from Woodstock, New Brunswick. She was diagnosed with stage 3A adenocarcinoma lung cancer in 2012. And it wasn't through screening, it was sort of by accident they found it. Heather knows firsthand the importance of access to potential life-saving treatments, early detection and research, advocacy and education. She has worked with other patients, caregivers, and stakeholders to create a community for those who have been affected by lung cancer. So she's one of our patient partners at Lung Health Foundation, but she also is a member of the Beatrice Hunter Cancer Research Institute Management Advisory Council, mouthful, and Research Committee, as well as a member of the Marathon of Hope Cancer Centers Network. So on behalf of Heather, Lung Health Foundation, we want to welcome everyone, and I want to just say a good shout out to all of our lung health ambassadors that I know we're joining from across Canada today. Now we can go back a slide and I'll introduce our speaker. So Ruud Velhausen is an associate professor of medicine and physiology and pharmacology at Western University, so that's in London, Ontario, as well as a scientist at the Lawson Health Research Institute. So following his undergrad studies in the Netherlands, Dr. Velhausen did his PhD in biochemistry at Western University. So we have a long history of working with Ruud at the Lung Health Foundation. He has a general research interest in lung health and disease. His lab focuses on various lung diseases. The focus is usually preclinical studies to understand disease development, as well as develop new therapies. His current projects in the lab include the impact of aging and exercise on lung injury, and we'll talk about what we mean by lung injury, and the impact of vaping on lung health. So that is why he is here today. And so with that, I'm going to pass things over to Ruud. Over to you.
Thank you. Just going to wait till I can share my screen. There we go. All right, hopefully people can see my screen. Excellent. All right, well, thank you very much for the opportunity to present today. And I'm hoping to get some feedback and some questions from you. It will be a talk mostly about, maybe a little bit more about vaping than lung cancer, but I think there's a lot of interesting information and certainly links to smoking and lung cancer that will come about. Let's see if I can forward my slide here. There we go, hopefully.
It hasn't forwarded yet, Ruud, but we'll just...
There we go. Yeah.
There we go. It's, yeah.
Excellent, thank you. So just as a little preamble of where I'm coming from, our lab, we're interested in vaping or the use of e-cigarettes, mostly in a laboratory preclinical perspective. So we're not actually working with humans that vape. We're mostly studying this in a laboratory setting, hopefully to make some conclusions about what happens in people, but we're not actually doing the research on people. So not that I'm going to talk about our research itself, just to give you a perspective of where I'm coming from. The objectives of the talk are to talk a little bit about vaping and smoking and making that comparison, or just the idea of just talking about vaping and regardless of smoking. And I'll talk about what I mean by that in a bit. Also, I'd like to give an overview of what the impact is of vaping on the lung and what we know, and there's a lot we don't yet know. Very briefly going to talk about secondhand vaping, and then the final few slides will be about the concerns about youth vaping and maybe some ideas of how we can go about trying to prevent people to vaping. So jumping right into my first objective, vaping versus smoking or vaping. So this cartoon here at the bottom, which is not related to vaping, but it kind of implies the same thing that I will be discussing, and that is depending on what comparisons you make and how you define things, you can make a lot of assumptions and then reach a lot of conclusions about vaping. And then in the context of vaping, this is often the I guess conclusion or thing that people say that, oh, but it's better than smoking. So let's look at that a little bit more in detail. So just a simple explanation of smoking that most people will know. It's a pretty simple process in some ways. We take tobacco leaves, we have some sort of vessel that we put them in, we light it, and we inhale the smoke that is generated from those tobacco leaves. And then obviously the consequence is that people get addicted and continue to buy cigarettes. Our attitude around this has changed. So you can see this ad here on the right-hand side for cigarettes in the 1950s and 60s, where it appeared to be a good idea to buy a whole sleeve of cigarettes for your mom or dad as a gift. Of course, it isn't that simple. It's a lot more complex. And this is shown on this slide here. We know that there's different tobaccos, there's different ways of delivering or inhaling that smoke. And most importantly, probably, is this bottom line here, that when you inhale the smoke from cigarettes or from tobacco, you inhale about 3,000 different chemicals. And this picture on the right-hand side here kind of shows some of these chemicals and what other uses those chemicals have that we are inhaling. And, you know, there's carbon monoxide is a good example. And obviously, there's the nicotine, etc. The ultimate effect of this, and if you go to like the World Health Organization, the conclusion is that tobacco smoking or cigarette smoking is the leading cause of preventable death in the Western world. So this includes lung cancer. It also includes COPD that Justice talked about a little bit, as well as a number of other diseases, heart disease. It can lead to preterm births in people that smoke during pregnancy. A lot of negative consequences. So what about vaping? So vaping, like smoking, is actually pretty straightforward. We have a power source, a battery in this case, that heats a heating coil inside an e-cigarette, shown on the left here. And this heating coil generates an aerosol or a vapor. Aerosol is probably the better word, just because vapor refers to water type of water situation, whereas here we have kind of a lipid mixture that's being heated, creates an aerosol that is then can be inhaled. The aerosol contains nicotine, and we can also become addicted to nicotine through this process. But like smoking, it's also a little bit more complex. The complications with vaping, or the complexity, are illustrated here. First of all, there's over 16,000 different flavors. We're not talking only like tobacco type flavors. There's lots of different flavors. They're very appealing to kids, and it complicates how we can study the impact of vaping. There's hundreds, if not thousands, of different e-cigarette devices. And on top of that, there's a whole subculture of people that vape that includes creating their own e-liquid to try to vape, that changing some of the e-cigarettes to change the resistance of the coil so it becomes warmer or things like that. And ultimately, there's lots of chemicals that are associated with the aerosol you generate. So the process of generating this inhalable aerosol means not only that the ingredients that are in the liquid are exposed into the air, but actually that process causes the formation of a lot of other chemicals by heating these liquids. So you inhale a lot of toxic substances. So the current maybe conclusion, if you take the literature on vaping, is that it can do some damage to your lung. There's something called e-cigarette or vaping associated lung injury that I will talk about. And there's a number of other negative consequences of vaping that I'll be discussing. However, when we start comparing vaping and cigarette smoking, it just, based on those two main conclusions that I just made, like most easily preventable death or leading cause of preventable death in the Western world versus the vaping can lead to lung damage, it seems to be an easy choice, right? Vaping seems pretty good. However, I don't think this is the case. In the next couple of slides, I would like to illustrate why that is. So the first and probably main part is we are very different stages of our understanding what happens to our lungs when we talk about vaping. So this is something I just did for this talk, and I looked at a database called PubMed, which is a database of all scientific articles associated with any topic. So I did a search for smoking or tobacco, and I compared that to a search on vaping and e-cigarettes. I just got the number of papers, scientific papers that were published on the topic. And as you can imagine, there's lots of papers on smoking and the effects of smoking in the hundreds of thousands. Whereas, when we look at vaping obviously only started in 2003. So there were very few papers, and they're now in the last decade and in the last few years, this number is increasing, but we're still only at about 6,000 in the last decade, and about the same over the last few years. So just to put that in perspective, if we look at the total number of papers that are published, scientific papers on vaping, it's about 13,000. That is about the number of papers that were published about smoking and cigarette smoking in 1973. Now, science moves a different way nowadays than back in the 70s, but still it gives you a perspective that our knowledge is kind of at that 1970s level for vaping as compared to smoking. So to put that in another context, in a more visual context, I just showed you this picture of an advertisement for cigarettes in the 1950s, early 60s. This is a picture of an advertisement for e-cigarettes in the last decade. We're kind of at that level. And in fact, if you look at all the advertisements from back in the 1950s and 60s for smoking, we can find equivalency for e-cigarettes from the last decade. So whether that is an association with Valentine's Day or any sort of doctors being involved in it, or like I said, Mother's Day, Father's Day, all these advertisements have their equivalent picture for vaping. So we're kind of making similar mistakes that we made in the 1950s and 60s for vape. We make them now about vaping, or to put it another way, companies use the same strategy to get people interested in e-cigarettes as they used in the 1950s. The second reason why I don't think it's an easy choice, or is actually, should it be a choice at all? And I refer to my two nieces. They came to visit me from the Netherlands a few years ago. And during their visit, their main game to play with me was these questions of, would you rather? They kept on bombarding me with these questions of, would you rather lose your left pinky or never eat French fries again? Or would you rather lose an eye or a kidney? And I very much like my left pinky, but I also love French fries. And for all these questions, I was always like, I don't want either one of these. And they kept on asking, and it was kind of fun. But I think the same kind of applies for vaping. It's not smoking versus vaping, it's just vaping. We should not vape regardless of how it compares to smoking. And again, I'll go back to companies and how they're approaching this. They're really targeting people that haven't been smoking in terms of getting them addicted to nicotine. In this slide here, you see like the advertisements or the packaging for some of the e-liquids and the different flavors, very much targeting youth rather than adults. And the same goes for some of these vape pens that you can see on the right bottom hand corner here. Now, not all of these are not legal, but you can kind of see the idea of the appeal of these as well as these flavors is not just people that smoke that want to quit, they're really trying to get a new generation addicted to nicotine. And that is not a good thing, independent of comparing it to smoking. So I think that's a real message that we should think about when you think about vaping. So in terms of my first objective, the take-home message is that when we talk about vaping, the comparison to smoking is valid, but only in certain circumstances. Only maybe in smoking cessation, but even there, it's debatable if it's actually working. We can think about it in terms of nicotine addiction. We can maybe look at it and go like, oh, we shouldn't be doing this the way we did it in the 1950s. But there's a lot of circumstances where we should just think about vaping and how we can address the problems associated with it. Moving on to my second objective, and that is, what is the impact of vaping on the lung? I've already mentioned this, about 13,000 scientific papers out there, and that seems like a lot, but it's actually not that many in context of science, right? Like I already also mentioned, there's 16,000 flavors of e-cigarette liquids available. So 13,000 papers, a lot of them are surveys, lab studies. We're still interpreting all that data, and sort of this cartoon, which was not a cartoon about vaping. I put the text on top of it. It was a cartoon about the stock market, but the idea is the same. Is like, if we take all the data, can we really figure out what is happening with vaping? And the bottom line is that the graph here at the bottom that goes to 0 is our level of understanding. I don't think that's quite the case, but making sense of all the data will take some time and will take some careful considerations and probably more research as well. However, we do know what is happening to the lung to some extent. We have some information. The main information on the damage of e-cigarettes on the lung, or probably the first time that it really hit the spotlight and people were made aware of it, was an outbreak of what's called e-cigarette or vaping-associated lung injury, or E-Valley. This happened in 2019, mostly in the US. There were some cases in Canada. And there were about 3,000 cases, 68 people died, and the damage of the lung caused by vaping was basically a severe but very acute difficulty breathing. People were rushed to the ICU, they were put on ventilators, and as I mentioned, several people, or quite a few people, died of this. Since then, quite a bit of research were done, and they kind of identify one particular component within the e-cigarette liquid called vitamin E acetate that, when it's aerosolized, can cause a lot of damage that can lead to this acute lung injury. So vitamin E acetate is no longer used in e-liquids, but it gave us this first real indication that, okay, wait a minute, we're putting things in our lung, it can do some severe damage. So obviously for this talk, lung cancer is of great interest, and the unfortunate, or maybe fortunate, depending on how you look at it, part is that we don't yet know enough. Vaping has not been around long enough to really get these longitudinal studies that we have for smoking to really definitively, which we try to do as a scientist, say whether it causes lung cancer. However, there's very good evidence that those aerosols that you produce contain known carcinogens, right? So you can sort of add 2 and 2 together. If you inhaling carcinogens, you kind of know what's going to happen. But because we haven't been studying it for very long, it's hard to make sort of those firm conclusions and show you the data for that. The impact on asthma is a bit more well known, I think, partly because asthma is maybe a bit more acute response. And there's very strong evidence that using e-cigarettes can actually trigger asthma attacks, or that people that use e-cigarettes that have asthma, they have more trouble controlling their asthma, that they in terms of when to take their puffers and so on. It may also lead to the development of asthma. And there's a lot of lab studies, so looking at different cells and some studies in mice and rats that show that the aerosol from e-cigarettes impact some of the responses, some of the cells and the pathways associated with that, the inflammation that are correlated to asthma. So there's pretty strong evidence that this e-cigarette can directly impact whatever processes are going on inside your lung. They can be affected by e-cigarette aerosols. Finally, and this is sort of a more global component, there's a lot of work being done in different labs in different circumstances to just investigate what this aerosol does to certain cells. There's some work in animals, and in general, what is published are these negative outcomes. And that sounds very vague, but the general concept is that e-cigarette aerosols affect your lung. Sometimes if you're a healthy individual, you may be able to deal with these negative or these damaging molecules and particles that you're inhaling, but it does affect your lung, and it may actually make you more susceptible to things like influenza or COVID or other infections conditions. So just to sort of summarize what the impact is of what our state of knowledge is in this area is, I think a healthy person, if you're start vaping, the long-term consequences, we don't really know, but you're inhaling carcinogens. We don't have the data yet. We don't have data on COPD, which also takes many, many years to develop. But it wouldn't be surprising if there are these long-term consequences. Short-term, there's many healthy people that may vape that don't think it affects them. However, their lung will be affected by the e-cigarette aerosols, and they may be in a subclinical state. So they are not aware that there's things happening in the lung until something else happens, until they get infected by COVID or influenza, etc. In which case their outcomes are much more severe than they may be if a person does not use e-cigarettes. Secondly, if there's people with a pre-existing condition using e-cigarettes, in general, the research suggests that they have worse clinical outcomes. So that is asthma as a good example. And in addition to having these worse outcomes, it may also lead to further problems with infections or other diseases. So in terms of my second objective, there's strong evidence that e-cigarette use negatively impacts the lung. We don't have all that data if we compare it to smoking of lung cancer, COPD, but we clearly have the evidence that suggests that these things are occurring. Very briefly, I'm going to talk a little bit about secondhand smoke or secondhand vaping. This cartoon sort of illustrates, 86% of people believe any data you put on a PowerPoint. It basically says, I don't have a lot of data on this. However, there is a nice article, and this is a complicated figure. It's a graphical abstract of this paper, trying to illustrate the problem or the difficulty studying secondhand aerosol. So if you just focus on the top right-hand corner, when you study this, it may differ on how you try to sample the aerosols. Are you using an actual pump to filter the air and find out what is in the air after someone vapes? Or are you using a passive filter? What chemical analysis do you do? What particles are you looking for? Another scenario you can think of is, like, obviously, just like smoking, it's affected by where the secondhand vaping occurs. If you're in a small car with the windows closed, exposure is much larger than if you're in a public place with high ceilings and lots of space between people. And then there's a number of other factors as well. how far you stand from a person will obviously affect how much exposure you have. The puffing duration and puffing frequency are also factors. So very, I guess, different than smoking, where you smoke a cigarette continuously. E-cigarettes, you can press the button or you can inhale once every 10 minutes first, or every other breath, right? So there's a bit more variation in how much exposure a single person that is vaping produces as compared to smoking. The bottom line for the authors of this paper suggests that there is potential risk for secondhand e-cigarette aerosols, and this area should not be ignored. They also outline that secondhand aerosols range widely depending on how you study and what study scenarios you utilize. My sort of take-home message is the studies are limited, but taking precautions is wise. I think the obvious thing is, if we know that e-cigarette aerosols contain toxins, it's probably not a smart idea to put those in your lungs. And if that's not a smart idea, putting it in your lungs as a secondhand kind of vapor or aerosol is also not a smart idea. So I know in Ontario, most places, probably most places in Canada, vaping in public places is seen the same way as smoking. So people have to go outside in restaurants, etc. But certainly inside your house, I would also treat it the same way. If you are asking people that come and visit you to smoke outside, I would do the same for using an e-cigarette. All right, the final topic is concern about youth vaping. So as I think Jess also mentioned, this is the main interest of the Lung Health Foundation, is those people sort of really young to about 30 years old that start vaping that may never have smoked. How can we reach them? What can we do about that? And this is a cartoon, is again, I've modified it slightly. The person originally in the cartoon was an elderly person running away, but the same or maybe even more applies to youth, that trying to provide them with information is really difficult for youth. And we'll discuss that in a little bit. So one of the questions the Lung Foundation asked me when giving this talk is like, how concerned should we be? The answer for me is that I don't know. I don't know the units of concern. I can say, oh, we should turn it up to 11, but the truth is we should just be aware of this, and how much you should be aware of may be different, or how concerned you should be may be different for different people. But certainly there are lots of topics to be concerned about, right? There is the addiction to nicotine, the impact on lung health, or even general health. We haven't even talked about that. There's also some data, although it's conflicting, that it may actually be a gateway to smoking, right? So whereas some of the companies use e-cigarettes and say like, oh, it's much better than smoking, it's a way to stop smoking, it may, in these people that get addicted to nicotine, it actually may be leading them to start smoking. And there may be lots of other reasons to be concerned. A couple of things that I like to mention just to consider. Most of the youth, they don't start vaping because they know they are inhaling toxic molecules or toxic material. It's often done because of their peers, so there's social pressure as well as anxiety and stress, etc. So being aware of that, I think, is essential if we want to move forward. Second, teenagers are more influenced by other teenagers, by their peers, than they are by us. The example I tend to use is in if I give a talk about sort of career perspectives and people ask me, what advice would I give myself, my younger self, now that I have all this experience, or now that I'm old, essentially. And the answer I always give is that I would not give myself any advice, because I know when I was young, I would not listen to someone that was as old or looked like me. So I think the truth is still the same for youth nowadays. So we need to consider that concept as well. And as a third consideration, a lot of youth is more aware or more susceptible to information that represents an acute problem versus some long-term outcome. So this idea of, that you may develop lung cancer from vaping is much less has much less influence than if it, for example, would impact their ability to play sports or very acute impacts on their health. What can we do? Again, this was sort of a question asked by the Lung Foundation to cover. What can parents, grandparents do? I think the first part is really to listen to people rather than tell them what to do or not to do. Be aware of what's happening, why people are vaping. It's also very hard to generalize advice of what to do. You have to know the individual that it applies to. But we can also, if you want to make a little bit more trouble, talk about policymakers, politicians, school boards, etc., to start implementing some policies that may limit vaping and vaping access. So the final thing, just to bring it back to our lab, just maybe to get some feedback or some ideas. One of the things that we are trying to do to address this issue, which is very new to me, and I'm kind of excited about it, is we're hoping to hire some high school students, kind of shown here, in our lab and actually have conversations with them to do a project about vaping. So rather than us deciding, oh, this is important, this is what the scientific literature is showing, talk about what is happening at their schools or in their environment with their friends and design a project. Hopefully, these students will then work in the lab over the summer, help with experiments, hopefully get some good results, and we will have some outreach where we use social media rather than writing it up in some obscure scientific journal. Use social media, reach out to school boards, etc., and try to reach people by that manner. So that is pretty much it. My take-home message about youth vaping is that it is definitely a public health concern, and we need some really novel and thoughtful approaches to try to improve this. And maybe there are some lessons from our history with smoking, and maybe we can be a bit ahead of the game in terms of how we deal with vaping as compared to smoking, and not wait till it's at a very late stage. And with that, I'd like to thank you for your attention and hopefully be able to address some of your questions. So thank you very much.
Thanks so much, Ruud. I believe we're going to be looking at questions and comments in the chat, so I'll hand it over to Trevor in a minute. But one of the things I did want to say, just in building on, excuse me, building on what Ruud has said, when we've looked at data coming out of BC, actually we work very closely with the BC Lung Foundation. They some of their data showed that youth 15 to 19 who vape, only 6% are former smokers, and so in that data set it's quite interesting. But in fact, vaping actually made them 3.5 to 3.6 times more likely to smoke in the future. And again, that's a sample in BC, but it is interesting to your point, Ruud, around there's so much we don't know, but then there is more and more sort of trends that we're seeing that should make us sort of be more aware of, like, well, what's the impact, particularly in Canada, where we've seen smoking rates among youth go down, which has been sort of touted as a success in this country. And then just your point around youth vaping is not a coping mechanism. So 31% of 15 to 19-year-olds report vaping as a form of stress reduction. But meanwhile, youth with poor mental health are twice as likely to vape. So that stress anxiety that you're talking about. But then we also know that vaping is actually associated with increased depressive symptoms and suicidal ideation, right? So, it's tricky. Anytime you're talking about addiction, as well as lung health, and we are not an addictions organization, but certainly when we look at all of that data together, it's one of the reasons, the slide that's up now is one of the reasons that the Lung Health Foundation is particularly concerned, and really are talking to politicians, to Ruud's point, of trying to better influence policy across like municipal, provincial, as well as federal. You can go back, Natalie, sorry, as much as possible, so that we can say, like, this is a crisis. It is a crisis, because despite the fact that we don't necessarily have the longitudinal studies, it's alarming when you look at the amount of vaping that is going on for youth. You know, we've had lots of examples from the providers that we work with and some of the youth workers of, you know, 8-year-olds having vapes in their lunch at school, and the teacher confiscates it because the parents don't see it as being harmful. It's sort of because, to your point, there's so many flavors and the way in which they're marketed. So, you know, it's a concern for us. So we've created the Quash program, which is powered by us, but specifically focused for youth. It was created by youth for youth. So it's an app that people can download on their phone, any age. Honestly, we have lots of adults that are using it quite successfully. And what it is, it's a behavioral intervention. So think of Noom. There's a whole bunch of them out there that people are using for weight loss, but it really helps people put in their goals, whether it's quitting smoking or vaping, and supports them throughout that. But then our full program also trains up people that work with youth, teachers, counselors, coaches, parents, except even other youth, on how to support people's quit attempts or reduction in vaping. So quashapp.ca is the place where you can go to learn more. Send it around to people that you know that might be interested. We're currently working across the province of Ontario and in New Brunswick with school boards to do some of this training across schools to principals and vice principals, guidance counselors, parents, teachers, etc. So we're really excited about that. And then the next slide, Natalie, is our advocacy work that we're doing. So again, we will send you a link to this when we're following up, but the URL is there, and this is how we're activating some advocacy. So if this is resonating with you and it's something you'd like to get more involved with, one quick thing that you can do is just go to this address and say you're going to take the pledge with us. And the pledge is basically, we would like kind of a vape-free generation here in Canada, and that more needs to be done to support both smoking and vaping in Canada's youth. So we invite you to do that. I'm going to pause here. I'm going to turn it back over to Trevor, because I'm not sure to what extent there's questions or comments, but we're happy to do that. And then we can wrap up with another way that you can join in with the Lung Health Foundation. So Trevor, over to you.
Excellent. Thank you so much. And thank you to both of you guys. It's been a fantastic webinar, just talking about where we are with the science right now and a lot of things that we're doing with youth vaping, because even just outside of cancer risk and disease risk, it still is a very big problem. This is actually a question is from me. And again, if you have any questions, please go to the GoToWebinar option. You'll have the questions tab right there, and you can just put in your questions and we will read them out to see if our lovely presenters will be able to answer them. But Ruud, just for a question about the amount of research being done, because as you've shown, there's tons and tons of material about lung cancer and smoking, but not so much about vaping, and it's still an up and coming body of research, and it's still very new. My question is, do you feel that at some point will there be almost a when surveys start ramping up and whenever this is getting more, that there should be like a comparable amount of surveys done year to year between these two different points of research?
So that's an interesting question. You mean a difference or an equivalent amount of research on vaping versus smoking? Is that what
somewhat like that? Yes. Yeah.
On cancer risk in particular.
On cancer risk, I would hope that we are ahead of the game with vaping, that it will not come as far as smoking ever did in some ways, right? So it is. There is potential. I don't know. Like, it's hard to predict the future. There's potential that I guess it will correlate directly with how damaging vaping ultimately turns out to be in terms of cancer and other long-term diseases. For me, it's tough, and it sort of relates maybe to what Jess says, where the Lung Foundation, they can be a lot more straightforward and saying like, we shouldn't be doing this. I think as a researcher, you know, we're always, and you see that like in climate change and other things, right? Like we sort of go by the statistics and, you know, we say like, oh, there's carcinogens in e-cigarette aerosols. We don't say it causes cancer, and it's sort of how we're thinking about it and how much evidence we want for certain things. But at the same time, you can kind of see the, you know, the obvious connection between those two. So hopefully, if we are interfering earlier, then hopefully we don't need all that research. But yeah, there is potential that it will lead that way, and that the cancers that develop or the long-term consequence of e-cigarette vaping, they may be different than what happens with cigarette smoking. So they may also require different types of research and different interventions as well. So
Yeah.
I know it's a long answer touching upon a lot of different things, but yeah, so that's my general sort of feel for it on that side.
Yeah, and I can add a little bit too. I think to Ruud's point, like the different types of research we're talking about, like when you're in a lab and you can expose, you know, from an animal exposure to sort of see what happens over time is very different from applied research. And so I'll say I come from the applied research side. So just taking that, what that means is, how is this affecting patients and how are we collecting the data that we're going to need now to look at it over the longer term? And what I would say there is, because there's such a challenge across the general population, healthcare professionals, health system as well, around, well, what are the effects of vaping? You know, it took a really long time in primary care to even make sure that your primary care record was checking the box to say you were a smoker or had a history of smoking, so that we could look at that data, so that your provider could say, oh, hey, you're at greater risk for lung cancer because of your smoking history, therefore I'm going to refer you for screening. We're not even at the point of capturing whether or not an individual is vaping and the extent to which they're vaping, right? So that's going to significantly limit right now, right, like what we can track over time. Certainly there's going to be studies where you can sort of say, for people to do recall, right, of like, how much have you smoked or vaped in your past, and use it that way. Not to say that that's probably going to be the best that we've got in a lot of the studies that you might see. And that's tricky, right? Like we run surveys as well. We're working on a national survey. Health Canada surveys now out to use to just get a sense of what is that order of magnitude, but you are relying on the individual sort of disclosing that. And so there's going to be different ways to do it. But I think that as we're advocating more and more for it, and more of that evidence is coming out in terms of the potential impact on lung injury, mental health, cancer risk, it is going to push the health system to start tracking more consistently whether or not people are vaping and to what extent. But that will take some time as well. But it is something that we can, again, learn from what we did with smoking, where we realized, oh, we can't quickly pull everyone at high risk for lung cancer from a family physician's office, or, you know, necessarily, because we just haven't been tracking it. So, you know, there's lots of places where I think we can learn, from other opportunities that might have been missed or we could have implemented a little bit sooner. So that's what I would say from the applied research lens.
Excellent, thank you. Thank you to everyone who also is putting in their questions. I would just briefly like to put an eye on the chat for 2 seconds, because a number of the resources that the Lung Health Foundation has provided, I put it in the chat, links to that, so that you can go and look at those in your own convenience. Jennifer asks, most vaping discussions take place around nicotine. What is the current scientific opinion of nicotine vape versus cannabis vape?
Ruud, would you like to take that one?
The scientific, I don't know if I can go too scientific. I think, again, research is a little bit limited. It's certainly one of the areas that is becoming more popular, obviously, since cannabis has been legalized. I kind of see them in some ways very similar, in the sense that some of the, like, there's certainly an addiction issue with nicotine, and it may be more than cannabis, but I do think that some of the damaging effects may be very similar. I think one of the ways we think about it in the lab is we actually aerosolize, or we use an e-liquid that doesn't contain anything like nicotine. It just contains kind of the liquid itself without any flavors or fragrances. And we sort of look at the effects of that because that applies to everyone that vapes. Because one of the things in these discussions often is, and we had a little bit of this when we were publishing a paper where we were studying, getting into details now, but we were studying how the aerosol impacts surfactant, which is in the lung, and we used actually from cow lungs. We use this surfactant because it's available, and we know it's very similar between cows and humans and basically all mammalian species. But you immediately get these responses like, "Oh, but I'm not a cow." And the same goes if we start talking about a lot of different flavors or cannabis, is like, "Oh, but I don't smoke or I don't vape nicotine. I vape cannabis, or I don't vape that particular flavor that seems to be damaged. I'm vaping that." So I think it's really difficult to actually go through all of those. But cannabis is definitely an area that we are thinking about in terms of the future, because it is, as I think the question implied, sort of becoming more and more popular, and that's something we need to be aware of. So, pretty vague answer again, but that seems to be my specialty.
So Bev asks, what efforts are being taken to work with suppliers to control or put out warnings on the packaging?
So it's a great question, Bev. And similar to, we were just having this conversation as panelists actually. So there is increasingly more and more legislation that's being put in place at the federal level, but then also sort of within provinces around packaging and labeling. So very similar to our experience with cigarettes, right? And again, this is one of those areas where you're like, you know, it would be great to just apply a lot of what we did and learned through the smoking cigarette experience to vaping. Because if you think back to that slide that Ruud had put up, the packaging, even though they're not necessarily legal, but people still have access to them, looks like a Nintendo controller, or, you know, looks like a toy, looks like, and so to your point, there's a lot of complexity around working with manufacturers or legislating, right, regulating what manufacturers have to put on their products. And then those are the regulated ones, doesn't include the ones that pop up at your corner store down the street from the high school that looks very different, or that it could look like that. So I guess the short answer is it is happening. It is in progress in this country and in other countries. You know, I think there's a nice debate around whether or not it's happening fast enough, and to what extent we can do more, even in terms of looking at where you should be allowed to sell it, and whether or not you kind of take that approach to it. And there's lots of different examples. We're all kind of watching each other across the globe because the different jurisdictions are trying different things to that extent. So, you know, we're happy to provide a couple of links to Trevor, if that makes sense, to participants after. If you're interested in any of these pieces, we can kind of point you in the right direction. But it is happening, and we are very supportive of it, along with all the other lung organizations in Canada. But we know it's going to take a lot of different approaches to really try and impact change here.
Yeah, if I can just briefly jump in, the other part that again, not my area, but that is interesting, and why we probably need a lot of people to be involved in it is a $1 billion industry in Canada. Or $1.5 billion, and like $8 billion industry in the United States. So there's a lot of you know, if it's a battle between the companies trying to sell it and us, you know, trying to promote lung health, yeah, we're up against the gigantic amounts of funds anyway. That makes it rather tricky. So.
Alrighty, so that's all the questions we have today, and I think that will be a great place to put a stop to this. And I think that's a very fantastic webinar all around. I think that it's definitely something that we're going to keep an eye on in the years to come, especially as the research goes through, while also keeping in mind that of the damage that we do know that vaping does to health. So thank you very much to everyone, and also thank you to Natalie in the background as well, who is also working with the slides from the Lung Health Foundation as well. So thank you very much for that as well. So fantastic all around, all you guys, and thank you very much for a very fine webinar.
Thank you again to CCSN. Have a good afternoon.
Bye.
Now, this is one in a series of webinars we are presenting this fall. Our next one should be happening either this week or next. So stay in the loop about webinars and make sure that you're subscribed to our email. But if you are not seeing our email, check your inbox. We do use a third-party email service, so make sure that you are getting our emails. If you're not getting our emails at all, you can go to our website and subscribe from there. And if you are subscribed to our newsletter, you can find not only our webinars, but also the latest news and other resources that we are providing. And all the webinars can be found at survivornet.ca/webinar or on CCSN's YouTube channel. I hope everyone has a fantastic day, and bye for now.